Vital Signs, starring Shandy J, Shanna K, and Kayla B.
Up is blood pressure.
While taking blood pressure is very important to remember what systolic and diastolic means. Systolic is when the ventricles contract. Diastolic is when the heart is at rest. Normal blood pressure is 120/80. The factors that affect the blood pressure is age, medications, and the emotional status. Before you take blood pressure, you need to wash your hands. Obtain a sphygmomanometer and a stethoscope. Meet Kayla. This is our patient. You must first enter the room and introduce yourself. Great job, ladies. The next thing you're going to do is explain to the patient what you're going to be doing and obtain consent. Observe the patient for signs or symptoms of stress or recent exercise. Position the patient in seating with forearms supported on a firm object approximately at the level of the heart, with the thighs parallel to each other and feet flat on the floor. Position self with view of patient and gauge. Expose the antecubital space of left or right arm without rolling sleeve too tightly. Okay, for a brachial pulse for the stethoscope placement. Clean the diaphragm with an alcohol wipe. Place the diaphragm on the skin over the brachial artery with firm pressure. Pump up the blood pressure cuff to 180 to 200 on the gauge. Slowly release the air with the valve. Listen for a heartbeat. Note the systolic pressure. Good. And listen for the heartbeat to start back up or to stop. And note the diastolic. Make sure you clean the diaphragm once more. Great job, ladies.
Respiratory rate and heart rate. Before entering the room, it's important to wash your hands and obtain a timepiece. Upon entering the room, it's important to introduce yourself and explain the procedure to the patient. It's best not to announce that you're taking the respiratory rate, rather say you're taking pulse. This makes sure the patient stays relaxed and doesn't concentrate on their breathing. There are 7 places you can take a pulse. The temporal, which is the head, the carotid, which is the neck, the brachial, which is at the bend of the elbow, the radial, which is at the wrist, the femoral, which is at the inner thigh,
Put it up there.
the popliteal, which is the back of the knee, the dorsal pedal, which is the top of the foot, and the posterior tibial, which is the middle of the ankle. The most common used places are the brachial and the radial. For the pulse and the respiratory rate, we'll use the radial. Place 2 or 3 fingers on the radial or the thumb side of the wrist. When you start to feel a pulse, use your timepiece, phone, clock, or stopwatch to start counting to 30. The first 30 seconds will focus on the respiration. Watch the rise and fall of the chest, shoulders, or hopefully the stomach as you have their arm pressed against it. Normal respiration rate is 12 to 18 per minute. For the second 30 seconds, count the pulse rates. Normal heart rate is between 60 and 100 beats per minute. Now, since we're only taking each for 30 seconds, we'll have to multiply each value by 2. If not done properly, you'll get a poor reading. Things to consider are their emotional status, their physical activity, whether they've just gotten done working out, or their physical condition. If they're athletic, their blood or their heart rate and their respiratory rate will be slower. Record these values on the patient's chart and we'll move on to the examination.
Pain. and temperature.
Pain can only be measured by the patient, so they must tell us. It can be measured on a scale of 1 to 10. 0 is no pain. 10 means that they need to go to the ER. Pain can also be measured by a facial scale, which the patient will demonstrate their facial expression and the amount of pain. And from Kayla's expression, it looks like it is very severe. You don't need to cry to fake this much pain. The normal range for temperature is 96.8 degrees Fahrenheit to 99.3 degrees Fahrenheit. Temperature can be taken orally, rectally, temporally, in the ear, or in this example, under the axilla, which is the armpit. Factors that can affect temperature are age, environmental factors, infection, physical activity, emotional status, medication, physical condition, and cardiopulmonary disease.
This has been your how-to video on taking vitals. Thanks for watching.